Hey, it's Matthew McKenzie here, your main man. And this time I'm going to be talking about examples and things to look out for when mental health professionals give carers a tough time. And yep, it's a sad fact. This still goes on. The problem is really is when do those who are caring for someone with mental illness, like I'm talking about a family member, close friend going through mental ill health, when and how do carers realize this is happening? And if they don't know this is happening, then unfortunately, the results can be quite devastating, not only to the carer, but to the person that they're caring for. And the problem is there's a time limit when mental health professionals give carers a tough time or the runaround. I'll personally, what we'll do is we'll break down what on earth is a mental health carer, because I know there's some people that might be new to my lectures on these videos or new to the blog posts that I write. So it always helps to break down what on earth a mental health carer is. Basically, they're not trying to care for someone with a broken leg. I'll sort of describe at least a brief set of examples of what a mental health carer is. Then we'll go through 15 examples regarding lack of carer awareness, because that's basically what these examples really are. Not fully though. I think power, control, coercion does come into this as well, and also professionals taking a shortcut. And then, as usual, as with all my lectures, I tend to sum things up. But I think it was due time really to do a presentation like this. I just ran a chaos group today, and a carer who is really knowledgeable. I did mention on the lecture I was giving as to why I didn't provide examples of when mental health professionals are giving carers, the runaround or sort of bamboozling them. So let's go on to, what on earth is a mental health carer? Basically, it's someone that is caring for someone, an individual, maybe one or two more, but those who are is basically a person who's unpaid, informal, so they're not always, well, they don't always have to be there, but they're providing support to someone with mental health issues. The role of a mental health carer is basically offering emotional support during a situation where their loved one's experiencing mental health crisis. And even if they recover from that, there's still support coming from that mental health carer. And it could be providing practical assistance, helping to manage medical needs, handling crisis situations and safety observations, and advocating for the person in need, that being the person going through mental ill health. The importance of mental health care is basically is that they're literally crucial in the role of the recovery and the management of their loved ones' mental health conditions. They basically don't want to see the the loved ones, I suppose, advantages in life, I suppose, deteriorate. It's not the best word I can think of at the top of my head. They often sacrifice, unfortunately, the carers often sacrifice their own well-being for the care of the person that they are trying to look after. Unfortunately, the sad fact is not just the sacrifice, there is unnecessary sacrifice on what I'm about to explain to the best of my abilities off the top of my head. So, okay, what are these examples regarding lack of care awareness? And I didn't title this properly. I don't think it's just lack of care awareness. I do think some of these examples I'm about to give, when a carer is engaging or talking to mental professionals or social worker, could be consult psychiatrist, psychologist, professional therapist, pharmacist, that basically mental health professionals um, who may push back, give carers the runaround, use forms of power to ignore carers. And as you can see by the picture I've put there, we have a carer that's frustrated. That's how I would put it. So the first one really, and this is the most common of all the examples, is refusing to share relevant information. Now, there are many examples of this happening. I'm going to just give one here. That would be a psychiatrist refuses to share details about treatment plans or care plans, medication side effects, or the individual's progress of the carer. And they would be citing the big one, which is confidentiality. Even when the carer has the consent of the person they care for. Now, the effect on the carer would be that they feel unprepared to take on that caring role. Basically, the mental health team could say, well, we're going to discharge this person into your care and good luck. And that would mean the carer would have to deal with those consequences, to be honest. They're not sure what they're caring for. So the ability for the carer to provide effective support has practically gone downhill, and it leaves the carer excluded. Now, unfortunately, this does go on. And what's made more worse is if the carer has the consent of the person in their care, and this happens, then the result can be damaging, really, not just to the carer, but to the cared for, because they're not getting that support as much as they should do. So that's one example regarding to refusing to share relevant information. That's not the only example in that situation. I'm just pointing out, what they're refusing. There can be reasons, good reason if they don't have the consent, but there is some information that can definitely be shared to the carer. And one of the most important things is that the mental health professional should be able to listen to the carer. And unfortunately, that's off the top of my head. That's the big one in a sense where professional says, I can't talk to you anymore. And that's a big no-no when it becomes to professionalism in dealing and working with unpaid care. So let's go on to the next example. Ignoring carer's observations and concerns. So repeat that, ignoring the carer's observations of their loved one and the concerns if the person that they're caring for is becoming more unwell or something isn't quite right. So basically the carer is looking to see if there's a plan of action. What action will the team take? So carer reports a noticeable behavior or changes or worrying symptoms, but the mental health professional dismisses these concerns as exaggerated or irrelevant. The results of this really can be very, as looking at a picture of the man screaming. This can be frustrating for carers. They do have first-hand knowledge. They spend most of the time out in the community and even visiting inpatient wards, seeing their loved ones, learning about their behavior. They knew them before they became unwell. They knew them when they're unwell, and they knew them when they're trying to recover. So to have a professional, and admit they've been trained in their profession for many years, come along and say, your views regarding worrying or changes in the symptoms of the mental health symptoms of your loved one is just exaggerated or is not relevant to the conversation, can can put down the valuable insight of the carer as they would downplay it. And this is a really sad situation, and unfortunately this does happen. But the big reason I'm doing this lecture, I'm doing this video, is to make carers aware of when they are sort of given the runaround. Fortunately, quite a lot of carers will just sit there and take it. And I'm just trying to say these are things you need to look out for because it's not professional behavior. So, okay, let's go on to the next example. This is example number 3. This is basically minimizing the carer's role. Now, what's an example of that? Now, let's say a nurse or therapist. It doesn't have to be, those types of professionals. But let's just say for that example, a nurse or therapist downplays the carer's observation, assuming that only trained professionals can truly understand the patient's needs. And I've seen this firsthand. It's obviously happened to me a few times. What's the result of this example to the carer? Well, unfortunately, this can make carers feel belittled and, you know, ignored, despite we've got to admit that the carers give valuable experience and knowledge of the individual or their loved one's behavior outside of that clinical setting. Remember, um, families, carers, close friends spend a lot of time with their loved ones, peer supporters even. I'm going to relate it back to carers though, especially within the family. We can't ignore the valuable knowledge and the time taken to engage with professionals when they're observing their loved one. And stuff the carers do say should be recorded in confidence. Again, that's a big problem, though. The carer confidentiality can be an issue, but I think I'd save that one for another lecture. So let's continue on with other examples. And as a reminder, I'm only stating these things so families and carers who are caring for someone with mental illness can be aware when certain things like these are happening. And I will try and follow up this video on what to do when these things happen. Just a basic steps, really. So the next example is being unavailable or unresponsive, not returning any calls, hiding, it seems, or being too busy. Let's see an example of this. So a care coordinator or therapist fails, I repeat, fails to return phone calls or emails, not just for that day, but it's going on for days or weeks, leaving carers without guidance during a crisis, especially if it's during a crisis, or while awaiting answers to urgent questions. Now, the result of this can unfortunately lead, as you can see from the picture, can lead to an emotional roller coaster, really, for the family. High stress levels, high frustration, um, depression, anger, uh, because the problem is the carers don't know if they are even managing that crisis, and they're unable to manage it without the adequate support. So if no one's getting back to them from that from that team, then basically the carer is left in limbo and they're not sure what to do, and things could escalate. So that's number 4. We've got, I'd say, 11 more to go. So this one is a tricky one, really. It's a big issue, a big theme as of 2024 regarding carers from a cultural or even family dynamic. So unfortunately, it can be dismissive. So mental professional does not take into account of the cultural family dynamics that influence the carer's patient's perspective on mental health, possibly viewing their input as unhelpful and incorrect. I think the fault of this really is education. Education with mental professionals can be very rigid, maybe out of date. So it leaves them unprepared for what the focus is and I do agree it's a complex set of cultural focuses in beliefs. This can also spiral down to racism, which again is a problem within the mental health profession these days. So it's important, if you're a carer from a cultural background, is to be aware, and I will do a lecture on this at some point, is to be aware when they start dismissing your cultural beliefs regarding and the family dynamics as unhelpful, incorrect, wrong, and perhaps even placing biases, making decisions based on biases and race, which can have, again, a devastating impact on the relation between the carer or the patient with the mental profession. So we'll go on to our next one. And one thing before I do continue on is that the result of this can leave carers feeling that they're misunderstood, and if they're being discriminated against as well. So let's go on to the next one. This is again, another big problem really in the mental health profession, an over-reliance on medication as a solution. And we've got to remember the problem with this is the medications are not, there's still apparent side effects which can reduce the again, I'm not sure what the word is, I've forgotten. I would say I'd sum it up as the patient being able to get on with their daily life. Medication can, there used to be a word regarding medication as like a kosh, puts them to sleep. It might even sort out the mental ill health problems, but it causes other problems where they're putting on weight, drooling, dribbling, um, have the shakes, that types of stuff. And what example can we put? A carers express a desire to explore therapy or holistic approaches to their loved one's recovery. But the psychiatrist or the pharmacist insist on medication as a primary solution without considering the carers or the family's views. Now, the result is this can make carers feel like that they have no say in the treatment decision, especially when they've seen firsthand the side effects or the addiction from the long-term dependency on medication, which is unfortunately literally reducing the lifespan of their loved one. And I can say firsthand with my mum, she put on a lot of weight, straight and developed diabetes, um, other problems with heart problems and that type of thing. So the over reliance on medication, it's not just my own experiences, but I've seen this with others as well. If you're not clued up on this firsthand, it can, not always, but it can have a, a terrible impact on your loved one's life who's going through mental health. It's a double blow basically. Their mental health is fading, but now there's a risk of physical health issues. So let's continue on with some other examples. So refusing to adjust the care plan despite evidence, and not just any evidence. I'm talking about strong evidence. They refuse to adjust it. What's an example of this one? So despite the care's repeated observations that a specific medication or therapy is causing adverse effects and not producing the results, the mental health team or professional insists on continuing the current treatment plan without making adjustments. The result of this really is that the feedback will eventually create tension and it will lead to the carer or the family being frustrated, and they will in turn disengage or complain, and rightly, and to be honest, rightly should complain if there is refusing to adjust the care plan. What's worse though, and I'll probably come on to this, is there might be situations the carers can't even see the care plan, so they're not sure what to weigh things up against. It's a very tricky one. So again, you're sort of stuck. There are ways out of it. There are definitely ways out of it. But this is an example, I suppose, when professionals will give carers the runaround. That's how I would say it. Not only is disregarding the carer's mental health needs, oddly enough, this is not something I've seen. I mean, yeah, it happens. Not something that I've seen taken into account quite often. So a good example, the mental health team overlooks or disregards a carer's request for respite. Yeah. That means they need to take time out from their caring role or support services. So that means carer's not referred or they don't even identify the carer. Assuming that the carer's only role is to assist the patient. So it can spiral into other needs of the carers if the carer is beginning to suffer. And this is not a problem in the mental profession. I think this is more of a cultural problem as well. The way the mental profession is at the moment is it's very patient centric. There are big changes, and I've seen them, and they're doing some excellent work. But as it stands, the patient, quite rightly at times, is suffering a lot. But that does not mean that there shouldn't be means of support or checkup on the carer. The problem is when this happens, this is what I'm telling you is in regards to a lack of carer awareness, and what this will do is it'll lead to burnout, basically carer being burnt out and actually resenting the mental health team. They will not engage with the mental health profession or professionals and will walk away. When that happens, there's a risk of the patient or their loved one being left on their own, basically, good luck. And I think the outcome of that will be disastrous, to be honest. It's so important to keep those connections with the patient, and we can't ignore the work the family carer is trying to do. Let's continue. Number 9 is making assumptions about the carer's intentions. So what does that mean? Let's have a look at the examples. Mental health professionals might assume that a carer's input is controlling, or they're overly involved, especially if the carer is vocal, and not just once, not just twice, but they're saying, listen, this is my loved one's needs. Why is it being overlooked? So basically, what is this going back to? This is basically bias, to be honest. And it means the risk of what is happening is that the professionals are, they're beginning to avoid communicating with the carer, and believe that the carer's overstepping, when the carer's intentions are really just sort of trying to be protective and being part of that triangle, I would say, being part of that team. So I know professionals are under stress and they've got caseloads after caseloads. That I agree, but there's a risk on these assumptions. Carers are not just a tool in the bag, basically. And there are times when, unfortunately, mental system's overstretched. A carer will become more vocal about their loved one's needs. It doesn't mean that they're always being controlling. Let's continue. Got 5 more to go. So here's another one, very, very common, unfortunately. Again, I think this is due to power. This is what I was mentioning, power and control. Using complex medical jargon without an explanation. So what's the example of this one? So this would mean that a clinician, psychiatrist, mental health professional uses clinical terms and jargon when discussing the patient's diagnosis and treatment, when the care is present, obviously, without breaking down that information into plain old good language, plain language. This also can lead to, I suppose, a situation when there's not an interpreter or there's languages not this. Then that's a double blow, basically. If your English isn't that best, and that can lead to, again, your cultural bias and situation. But again, those who know the English can come up against a brick wall when professionals start using jargons, and there's a naughty reason why they do that. But carers who are not medical professionals may struggle to understand information, so they'll just sit there. We must remember carers are not medical professionals. They will struggle to understand information, and if this continues to happen, what will happen is that, well, they're intimidated, and they will disconnect. They just won't understand. But then there might be a reason. I'm not saying this always happens. There might be a reason why mental professionals would want to intimidate the carer. I'll give you a good reason why. There might have been a bad decision, and it's at fault with the professional. So in order to sort of hide from it, they might start using medical jargon to push the carer out, if you know what I mean. Well, I'm saying it's fairly controversial, but this does happen, and it's important carers, realize it. If they see this happening, point it out. Don't just sort of sit there and soak all that up, if you know what I mean. Moving on, failing to prepare carers for behavioral changes or crisis, basically not being part of that care plan or not including the carer. The example is the mental health team failed to provide guidance. I'll put it in bold, guidance on how to handle potential crisis, such as severe mood swings or psychotic episodes. So basically what they're saying is just good luck and get on with it. That's not acceptable. If there's a chance, and sometimes carers do need, if they're not told these things, they do need to be aware and ask those questions. How can I be prepared when a loved one's discharged into my care? If things take a downturn, if there's a severe mood swing, the care being at risk, what is it that they need to do? And this again is a lack of care awareness. This can lead to the carer being unprepared for challenging situations. And unfortunately, this could have lead to serious instances. Um, so again, this goes back to care awareness training. Carers should be given the appropriate training and information in regards to handling these severe mood swings, things like that, depending on the mental ill health their loved one's going through. Another one is being defensive when asked for clarification or second opinions. So an example of this is that a care requests clarification. This is perhaps a good example when it comes to jargon, I suppose. A care requests clarification about a diagnosis or asks for a second opinion, and the mental health professional becomes defensive, put it in bold, defensive, refusing to explain their decision making. And the problem with that when it comes to carers is that it can lead to a relationship where it's sort of difficult for carers to start advocating for their loved ones' needs. And when they can't advocate, then it's both the patient and the carer begins to suffer. I can't think of better examples. I'd have to be a whole lecture on that thing, but it does happen. Disregarding feedback from other health, this is really serious because any professional doing this is at risk of being brought up on this sort of thing. But when other health professionals are beginning to say certain things, like, for instance, the care brings up feedback from another healthcare provider, such as a GP or specialist, that might affect the individual's mental health treatment plan. However, the mental health professional dismisses this information instead of considering it. Now, this can lead to potential conflicts in treatment approaches. Again, this thing unfortunately does happen. The result is that when the professional dismisses this information instead of consider it, it can lead to potential conflicts in treatment approaches. Basically, it's not just ignoring the care, it's now ignoring other health professionals. Pretty serious, this one. But it's important carers sort of know when it comes to second opinions. And, this is evidence, basically, carers need to take note of. Coming to the end of this is the last two: inconsistency or contradictory information from team members. Now, this is again a big problem because it makes what's happening here is that there's not been team meetings discussing the case of a service user. Different members of the mental health team provide conflicting information about treatment, causing confusion in the carers. And when the carers are asking for different advice, for clear guidance, and there's confusion, the information isn't on point, then this will lead to the carer being frustrated and they will develop mistrust of the mental health team. Last one is ignoring carers' need for educational resource. So this is slightly similar to what I mentioned before when care is not given information to prepare for their caring role. When a carer asks for educational resources on the individual's diagnosis or condition, the mental professional offers no materials or support, leaving the carer to seek information independently. Lack of guidance on this sort of thing can lead again to missed opportunities to support the carer in their role. It's sad these things happen, and they still do, which is why I felt it was a great idea that the carer at my group, as of this video, said, put more information on examples of when carers are being given a runaround. I've only given 15. There are a whole lot more, to be honest. I might revisit this at a later date, but these are probably the most common ones carers need to be aware of. So to wrap this up, when faced with these challenges, it's essential for carers to persist. This is one way, to be honest, in advocating, assist and advocate for the needs of those that rely on them. Unfortunately, no fault of the carer, I would say, and certainly no fault of the patient or their loved one. They do rely on others outside of the clinical setting. As a reminder, carers can consider using formal channels such as the complaints procedures, getting advice, and there's a video I have regarding the use of care centers, so advocacy services, mental health advocates, and at the worst scenario of your pals. Do look at the videos where I've mentioned about complaints and escalation. It's not just that things, sometimes these things can be just sorted out with just a little talk, raising the issue. Because what we want to avoid is risk, harm, deterioration of the family, not just the patient. So I'd like to say, if you like this video, do give me a like. It helps to support the channel, and subscribe, because I'll continue to make more of these videos in order to raise the mental health care awareness and cancer carers. And there'll be times when I'll do stuff overall for all unpaid carers. I might start raising awareness and finding educational resources. I'd like to say thanks for watching, and remember to take care of yourself. You deserve it.